Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. A new study revealed star ratings for U.S. nursing homes can be volatile, with more than a quarter of 5-star facilities falling to 1-star status and over 40% of 1-star facilities later climbing to top tier. The study focused on overall ratings, aiming to establish a baseline for how much control nursing homes actually have over rating trajectory. On average, moving from 1-star to 5-star took about 54 months, while rising from 1 to 3 stars averaged 22 months. Findings suggest that ratings can swing drastically, and many facilities are capable of achieving meaningful improvement. Research raises important questions about how well the star system reflects long-term performance, and how clearly it communicates quality to patients and providers, highlighting need for CMS to refine its metrics to better capture consistent care quality, especially as short-term rating drops can lead to lost referrals and long-term damage to reputations. Experts recommend starting with QMs, as they're less costly to address and can yield visible improvements within a few quarters. Ultimately, the study reinforces the idea intentional, sustained quality improvement is the most reliable path to higher ratings and better care outcomes. As the U.S. population rapidly ages, several state legislatures are looking at financial sustainability of long-term cares. With demand increasing and costs rising, states are working to modernize outdated funding systems and align Medicaid reimbursements with the true cost of care. In Pennsylvania, the long-criticized BAF continues to artificially lower Medicaid reimbursement rates, widening the gap between funding and actual costs, setting providers up to fail. The state's reimbursement rate, $256 per resident per day, lags behind. With 30 closures since 2021 and 2,000 people waiting for a bed daily, urgent reform is needed. A proposed bill would allocate $140 million in new LTC funding, establish a 0.9 reimbursement floor, and modernize the BAF structure. Leaders agree reform must balance fiscal realities with the needs of a growing, higher acuity senior population. As costs rise and agency staffing becomes more expensive, stakeholders emphasize the need for long-term policy solutions, ones that reward quality care, fund provider sustainability, and secure access for millions of older Americans who will soon rely on these essential services. A new report warns nearly half of U.S. states are approaching a caregiving emergency, driven by home care workforce shortages and rising costs. The crisis is especially pronounced in states where rural populations and staffing deficits make it increasingly difficult for providers to deliver care. Seniors are relying more heavily on unpaid care from family and friends, placing enormous stress on informal support systems. Nationwide, unpaid caregivers contribute an estimated $375 billion in labor annually. The report also highlighted significant burden of dementia care, which makes up about 40% of the total value of unpaid caregiving in the U.S. Researchers warn without targeted support, demands will increase as the population ages and care needs grow more complex. Experts urge state and local policymakers to act now, particularly in rural and aging states. Investing in support for family caregivers could reduce long-term healthcare costs and help stabilize an already fragile care infrastructure. Recognizing the critical role of unpaid caregivers must be part of any serious strategy to ensure sustainable long-term care. Thank you for joining me for News This Week in Nursing Homes. To get more of Qsource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your QI needs, call the Q.